I am Dr. Tara Olson of Simmons Martin and Helmbrecht. I'm having my first mammogram today at our Frederick office. Mammograms are really the best modality that we have to screen for breast cancer currently. About 1 in 8 women in the United States will be diagnosed with breast cancer in their lifetime. And so catching it early when it's most treatable greatly increases the chances of survival. And so the recommendation currently is to start mammograms at age 40 for most women at average risk of breast cancer. Some women who have a strong family history of early breast cancer or other genetic disorders may start them earlier. Generally speaking, we don't do mammograms until after the age of 30, just because of the way the breast tissue is and the benefits of mammogram. So mammograms use a specialized low-dose version of X-ray, so they're an extremely low dose of radiation, which is why we can recommend them on a regular basis. We also currently use a 3D technology, which replaces the old 2D technology, which greatly improves the accuracy of mammogram, reduces the risk that you're going to get called back for something that's not significant. We also now have employed what we call second read AI. So it uses AI as a second look at your mammograms to maybe pick up some smaller things that a radiologist might miss. Recent studies have shown improved detection of very early breast cancers using that AI technology, and we only hope that it will get even better in the future. Screening mammograms are considered preventative care, so generally speaking, you have no extra cost associated with screening mammograms through your insurance. The only thing you may pay extra for at this point in time is if you want to do the second read AI. That's different from diagnostic mammograms. So if you notice a lump or pain or something in between your normal screening mammograms, you'll have something called a diagnostic mammogram, and that is subject to your copay and deductible. You want to arrive about 15 minutes early to ensure your insurance and all your information is up to date. It's really important that you're not wearing deodorant or perfume or lotions in your armpit area or around your breast. However, if you do come in wearing those, they will offer you wipes to kind of clean off that, as it can interfere with the imaging. So once you get here, you'll be called back by the mammogram tech. She will go over the process and ask some questions about your history. Then she'll have you get undressed. You'll then have the mammogram process, which takes about 15 minutes, where the mammogram technician, who has been trained specifically for mammograms, will position your breast in the right way and check the images to make sure she's getting this necessary images for an accurate mammogram read. Actually can get a mammogram when you're breastfeeding. We generally ask that you feed or pump about 10 to 15 minutes before your mammogram to empty out the breast as much as possible, which will improve the read of the mammogram. So once you get that report back about your mammogram, it's going to tell you if it was normal or if there was something concerning that needs to be followed up, but it's also going to tell you about the density of your breasts. Many women freak out when they hear that they have dense breasts. It's nothing to worry about, but it is important to know, as far as your medical history and screening, what it means. So dense breasts are just a version of normal. However, some women have less dense breasts and some women have more dense breasts. Extremely dense breasts do interfere with picking up small early changes in the breast tissue. So if you have extremely dense breasts and you have a family history of breast cancer or other risk factors for breast cancer, we may need to discuss doing an MRI in addition to your yearly mammogram. So all Medicare, Medicaid, and commercial insurance cover a mammogram over the age of 40 on an annual basis. However, that annual might be, today I can come on March 26th, next year I have to come on March 27th. Also, mammograms close together aren't as helpful. So usually, even if we're coming back for a second mammogram for following something, it's usually about 6 months later.